lot of people have tried it. Now, let me ask you this, because I've observed something, and I want to know if you've observed the same. There are two ways to test for low stomach acid. I'm using quotes because it's never that clear, but there's two ways to test for low stomach acid that are talked about in the integrative space and in the forums. I'm curious which one you've seen people do more on their own. Have you seen people do the baking soda test, where they mix some baking soda and water, drink it down, and wait and time how long it takes them to burp? Or have you seen more people do like the ever increasing dose of HCl until they get reflux? What do you see people do on their own?
I've seen both. I will say the baking soda one, more interestingly enough, I've seen people have really bad reactions to it. I don't know if that's something that you've seen before, but I've had two clients now who like had horrendous like gut issues after doing the challenge. It wasn't a guided thing. They tried it on their own. And I've kind of taken note of that. So I'm a little careful, I would say, with the baking soda one, the baking soda challenge. And again, I could see if that's sort of squelching the stomach acid you do have in some way. Maybe that's driving some of the symptoms that were precipitated in those cases. But I've definitely seen people doing the HCl capsule challenge as well, which I think could be helpful. I just wouldn't. I want people to be guided in that.
Yeah, I agree.
Because I just don't want people to think like, okay, I need 8 capsules of HCl with each meal now, and it's like you're going through a bottle of Betaine HCl in like 5 days at that dose. So that would be kind of my. But I've definitely seen both being done. Do you see one more than not the other?
Yeah, I don't know if it's like selection bias or, the area of the country I'm in, but I've seen quite a few more people do the baking soda test. And they'll report back to me, and we'll talk about, digestive juices and stomach acid, and they'll be like, well, I did the baking soda test, and it took me 5 minutes to burp or 4 minutes to burp or whatever. And I'm like, I personally don't think that was a valid test.
Yeah.
I don't think it's a valid test.
I agree. And again, like I said, I've seen some pretty bad reactions to it. So I kind of am leery of that to begin with.
Yeah. I don't think I've had anybody who's reported that they reacted poorly to it yet. Knock on wood. I don't really recommend this. So I don't know for my own patients either. Just people who have come in and tried it.
Yeah.
I've had a couple of people who had an adverse reaction to the other test where people, you start with a low dose of HCl and then you increase progressively. I've had some people respond poorly to that and get reflux. And I think the issue with them was that they started out at too high of a dose and they progressed too quickly, because the reaction ended up being acid reflux that persisted for, a couple of days or a week. So I do think you have to be cautious with that one. You have more of a chance of really aggravating the stomach locally, but I think that with the other test you probably have more of a potential to aggravate the intestines and all of the downstream stuff that relies on stomach acid to set it off on the right foot. So they could both be tricky, but it's like you have to work with what you've got if you can't find somebody who could do the actual test, and you can hypothesize based on your symptoms too. Now sorry, you were going to say something.
I think too, sometimes you can hypothesize based on other lab markers as well. Like sometimes if elastase is low and you have H. pylori or something showing up on your lab, you can kind of assume that stomach acid might be low. Sometimes certain patterns of bacteria on stool tests can kind of indicate that maybe digestive capacity isn't great. And again, symptoms for sure. I think you kind of want to look at the whole context of the presentation of symptoms, other markers, maybe doing some self-experimentation, but kind of taking the whole context of how everything's shaking out before kind of seeing what's going on.
Yeah, and I think that's a really valid point, that you can kind of you could deduce that this is more likely to be a thing for you based on some testing. So let's actually take a few minutes on that first, and then we can talk about symptoms of low stomach acid, because you can tell quite a lot from symptoms. It's not the be all end all, but you can get an idea of that. And then we'll talk a little bit about how to best try to test for this and, use of supplements. But for testing, I think you hit the nail on the head that if your other digestive juices are showing up low, like if elastase, for example, a pancreatic enzyme, if that's showing up low in stool, then there's a higher likelihood that you're not getting that signal from the stomach, right? Because normally the stomach is very acidic and it squirts out very acidic juice called chyme. And it's that acidity of the chyme that triggers a reflex in the small intestine that tells the pancreas and the gallbladder, hey man, we need some juice to neutralize this acid. And one of the juices that gets released is elastase, another one's bile. But it's that local trigger of that reflex to tell your small bowel, hey, this acidity is going to kill us. You need to release something else to neutralize that. So I do think that's one potential way. You mentioned microbes. And the idea with that is that if certain microbes, like the two that I always look for are Staphylococcus and Streptococcus. And there's other ones that sometimes can pop up, and I'll let you weigh in on that in a sec. But if there's bacteria getting through to presumably the colon and the stool sample that shouldn't have been there in such an abundance, like staph and strep that are local residents on the skin and the throat, then we can kind of deduce that they must have gotten past the acid barrier of the stomach, which means the acid barrier wasn't much of a barrier at all.
Yeah.
So those are the two biggies I like to look for. Are there any other bacteria that you keep your eye peeled for?
Those are the really big ones. And again, I think H. pylori I mentioned, definitely has the capacity to lower stomach acid. It's the obvious one. I think Strepto and Staphylococcus, again, are going to be, I think, not something that people look out for as potentially being lower for stomach acid. So I'm glad you brought those up. But yeah, I think H. pylori is one, and you usually see, I mean, at least in the stool tests I've looked at, you can kind of see, high strepto, a little bit elevated H. pylori, low elastase. You can kind of see the pattern. Yeah. Which is kind of what I try to look out for when it comes to spotting the low stomach acid stuff.
Yeah. Yeah, exactly. There's usually not one clear indication screaming at you, hey, low stomach acid. But if you could piece together either, blatantly low or blatantly high or like subclinical or suboptimal test results, you can kind of pick up on this pattern. The other one, and I don't know if you've seen this, I know when I was ordering a lot more GI map stool testing for my stool test of choice, side note, that's not really my favorite anymore. But I know in their interpretive guide that they give clinicians and people who order the test, they make a point of saying that Enterococcus can also be elevated in situations of low stomach acid. And I think maybe there was others, but I don't remember off the top of my head. I don't know. I know for sure when I was reading about it, it made sense that staph and strep could be elevated as a consequence of low stomach acid. I don't remember the logic with the Enterococcus being elevated, if it's the same kind of maybe it's a resident of the oral cavity or a resident of the skin and you're swallowing it and it's getting past the stomach acid barrier, but I would assume it's probably a similar logic. So that's another possibility. Now, what about symptoms? Symptoms of low stomach acid. And this can run the gamut, right? Because it's almost like
it really can.
If you have IBS, maybe you have low stomach acid. End of story.
Right.
We're good.
Right. I think, like we've talked about, I think on the last podcast we did on acid reflux, gastritis, that sort of stuff. I think with low stomach acid, it just kicks off digestion. So, I mean, anything downstream could certainly be affected. Yeah. I think what I typically see with low stomach acid, I hear a lot of times immediate bloating or feeling of early satiety, feeling like you just sort of ate a bowling ball type symptoms, a lot of burping. I hear, again, sometimes things like acid reflux, too, if you're just kind of not digesting things well. I definitely I think the biggest thing that I hear and try to keep an eye on is like the burping, sort of the immediacy of the symptoms coming up, especially if it's like at breakfast that they eat and they just feel awful like the second they eat, and it's just hard for them to get calories in. Sometimes a symptom of like struggling to tolerate things like protein or higher protein meals can be a big symptom. Those would probably be like the main like really obvious ones that I see. What about you? Anything to kind of run with from that?
Yeah, I think you hit the nail on the head. In particular, the intolerance or apparent intolerance to higher protein meals, particularly animal protein. Now, and this is the thing too, is that can also be a symptom of not adequately chewing your food. And that's a piece of the low stomach acid thing. Like, you're not going to make stomach acid worth a damn if you're not chewing your freaking food. So we'll come back to that when we get to like what you actually do about low stomach acid. But I do find, I mean, I've had patients who have told me in their intake forms or in the appointments that they became a vegetarian or they became a vegan because they didn't seem to tolerate animal protein. Like, they would eat chicken, or they would eat steak, or they would eat, whatever. And they would just get this like indigestion, blah, or like you said, bowling ball. I usually say a brick. Like, there's a brick of lead in your stomach just sitting there and not moving. And eventually people put 2 and 2 together and they're like, okay, I guess I don't tolerate meat. And then they just get rid of meat. And it's like, well, you probably could tolerate it if you actually had the stomach acid to break it down. That was the problem all along. So that's a big dead ringer to me. I tend to see more what I would call indigestion rather than reflux, although I've definitely had people who have what they think is acid reflux, and they have like the burning and the acidity feeling. And then it turns out they have low stomach acid, which is totally like mind-blowing for a lot of those people, because they've been told for God knows how many years that they have too much stomach acid and they need Nexium and whatever else. So I see that too, but I think more frequently it's this indigestion and this like blah and feeling like the food's not moving, or like early satiety and like belching and just kind of like blech feeling after you eat. I see that quite a lot with low stomach acid folk. Another one just to add to that I'm thinking of is like sometimes nausea. I definitely have seen that too with like lower stomach acid. Again, I feel like it's just kind of that blah feeling like you're describing. Nothing's really moving. Things are just kind of sitting there. You don't necessarily feel good immediately after eating. Sometimes if it's like more SIBO related, it takes a little bit of time to really experience the symptoms, whereas the low stomach acid tends to be more immediate upon eating. And kind of upper in the GI tract for sure, obviously, if it's stomach. I agree. And I do think the immediate reactions, like if you eat your first 2 bites of food and you already are feeling full, or you're eating 2 bites of food and you already feel blah, that's a pretty dead ringer for low stomach acid. Because again, it's like, you chew, hopefully, and you swallow, and then the food, it's almost like it has nowhere to go. It just camps out in the stomach, sloshing around with like a liquid that's not acidic enough, and your poor stomach is trying to process that, but it doesn't have all the tools for the job. So versus, at least theoretically, if you had something like SIBO or dysbiosis in the colon, you would have to wait for that food to get further downstream and actually make it to the small intestine or the colon. So if it's like, couple bites into the meal or very shortly after the meal, I would tend to think more upper GI. If it's, 30 minutes or an hour or 2 or 3 hours after you eat, then I would start thinking more intestine related as far as like the specific symptoms go. I'm trying to think. I feel like there might have been another one that I'm leaving out of my brain, but I'm trying to think of what the other ones were. So we talked about intolerance to meat, particularly, or high protein. Indigestion, although acid reflux can be assigned to. I agree. Nausea, I think, is there. Bloating. Also, I know a lot of my patients who have a lot of bloating, the bloating can greatly improve when we start to do the stomach acid kind of work. I think those are the biggies, at least for now.
Yeah.
I would say too, if you're a person who has been on a PPI or, Zantac or some sort of acid suppressor, or if you are a chronic Tums popper, you know you have low stomach acid because that's precisely what those medications are doing for you. You wouldn't take them otherwise. So you know without a shadow of a doubt that you have low stomach acid if you're on one of those medications. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.